Welcome to Health Watch, presented by Novant Health. I'm your host, June Baker. Today our guests include Mr. Shelburne Stevens, President of Brunswick Novant Medical Center, Dr. Edward Wu, a physician at Brunswick Women's Center, and Kenya Hooper, a surgical technician also at the hospital. Mr. Stevens will share information about the new medical office building located on the campus of the hospital. Then Dr. Wu and Kenya Hooper will tell us about the new Da Vinci surgical system recently implemented at Brunswick Novant Medical Center. Stay tuned to learn more about these valuable topics with Health Watch. Well, welcome back to the show, Shelburne. It's such a pleasure to have you here.
Thank you.
Now, for some of our viewers who may not have seen you on the show before or who haven't met you previously, tell us a little bit about your role at the hospital.
Well, I've been the president now for 11 months, soon to be a year. It's flown by.
Gonna have an anniversary.
Yeah, I've been with Brunswick for 7 years, and so I've had a variety of roles, but it's been an exciting year this past year as the president.
I'm sure it has. I'd like to hear a little bit more about your education and your background. I know you've got a varied background. You've done several things, so let's share that with our viewers.
I've been in healthcare for a little over 23 years. Wow. Started out as a respiratory therapist years ago and did clinical work for 10 or 12 years, and then got into leadership. Have a bachelor's in business from High Point University and an MBA from Gardner-Webb.
Excellent, excellent. And so now you've switched from the clinical side to the administrative side, but I bet your clinical background really helps with the administrative side.
It does help. Having that experience at the bedside really comes in handy as an administrator.
Well, good. Now, I know our main focus today is to talk about the new medical office building that I see has opened up next to the brand new Brunswick Novant Medical Center. When did that building open?
We opened it last December.
Last December. Well, what practices are currently housed there?
Currently there are 2, Brunswick Women's Center and Brunswick Surgical Associates are housed there.
And those are both Novant Medical Group practices,
Is
that correct?
They are part of the medical group.
Well, are there any plans in the works to add other practices to that space?
We are. We're just getting ready to start construction now for 3 more practices going in there. Brunswick Urological Associates will be going in there. Then we're going to have a primary care office space, and then Cape Fear Heart is going in there.
Cape Fear Heart, that's awesome. Right next to the hospital, that would be so convenient for the physicians.
It is. It's so good having them right next to the hospital. The proximity works well for both patients and physicians. It's easy for the physicians to come to the hospital to see their patients or perform surgery in the morning and go see patients right after surgery in the building next door.
Yeah, I bet it is particularly convenient for surgeons, and I was really thinking about the OBs when they have to deliver a baby. It's just so close to run across the street.
It is. It's working out really,
You don't
really
even have
well.
to get in the car anymore.
No.
That's great. Well, I know I attended the open house for the medical office building back in December, and the offices were very spacious and they were beautifully appointed and very, very nice, but they were also a little different from one another. And is there a reason why the layouts are different?
There is. We highly involve the physicians in the layout of their new practices, and we make them unique to fit their practice. So Brunswick Surgical Associates had input into the design of theirs to meet their surgical patient needs, and Brunswick Women's had input on the design of theirs for their expectant moms or other women that are coming there, and also for growth. As their services grow, we may add more providers to those clinics, and we need to go ahead and build that additional space now.
So the new spaces that you're planning, those physicians will more than likely be involved if they're already...
They've already been highly involved with the
they've
layout.
Already been, Well, great. I'm sure they're happy about that. Well, tell me, what was the main reason that Novant decided to build the medical office building on the Brunswick Novant Medical Center campus?
Again, it's the proximity and the convenience for both physicians and for patients. For the physicians, they can go back and forth easily, like you said, without having to get into a car. And for the patients, they could see the physician if the physician thinks they need outpatient imaging testing or something. Most of the time, that can be scheduled that same day or the next day, and it's just convenient for the patients right there.
Are there plans to expand that building in any way, or additional buildings on the campus?
As the need arises, or as we hire more physicians in or more specialists come to the area, we will expand that existing building, or we'll look at the option of just building a new building next to that one.
I imagine that you've had really great response from the community and the patients about that new building. Is that the case?
It is. They really like coming onto the hospital campus and having everything right there convenient for them.
Well, I hear the food at the hospital is great. So maybe they even have lunch while they're there.
A few do. A lot of community members stop by there for lunch from time to time.
Well, I know I heard the other day that cardiac rehabilitation and physical therapy also moved from their old space at the old hospital up to the new facility. Is that correct?
That is correct. We have moved them into the hospital main building there. Physical therapy is located on the first floor, and then outpatient cardiac rehab and pulmonary rehab are located on the ground floor.
On the ground floor. And I'm sure there's signage and all that. So.
There is.
Okay. Well, that's really good to hear. I'm happy that the feedback has been very positive about the new building there. But while I've got you here, I hear about this new service being offered, provided by Brunswick Novant Medical Center, and it's called the Care Now. Talk to me about that. And
we're very excited about Care Now, and this is really a service that we're providing. It gives patients access to a registered nurse 24 hours a day, 7 days a week. So if they have a question or they have an illness that they're not sure what to do, they can call this number and the nurse will help direct them to the appropriate care.
So it's kind of like the call before you call the doctor maybe, or before you
Exactly.
call the ER. You could call this nurse and talk to them about, and then they could better direct you perhaps?
They can. They will listen to what's going on with you, and if you need immediate care, they'll direct you to the emergency department, or they'll direct you to convenient care, or they'll direct you to follow up with your primary care physician. If you don't have one, they have a list of all of our primary care
really?
physicians in the area. They can direct you to one of those, and in some cases, they have access to go ahead and schedule an appointment for you for some of the physicians.
Well, that sounds like a great resource for the community. And is there a specific phone number to call?
Yes, any patients out in the community can call 910-721-CARE or 910-721-2273.
2273. How about, can you give us an example of when it might be appropriate to call Care Now?
Sure. A good example is a parent picks up their child from a neighbor's house who's been keeping them, and they had something for dinner, and the parent's not sure if they're breaking out in a rash or having an allergic reaction, and just have a question and uncertain. This is a perfect example to call that number, speak to the nurse, talk to them about the signs and symptoms. They'll ask you specific questions, and they'll help you determine, does the child need to be seen at the emergency department or go to convenient care, or what needs to be done for them. Or it could be your child just gets sick and starts running a really high fever in the night and you're not sure what to do with your sick child. They can help get you to the appropriate care that you need.
And so it's 24/7. You can call any time of day or night.
24/7, any patient in the community can call with any question that they have.
That's great. I love that resource. I
It
may
is
have
awesome.
to use that myself. I also heard about the MyChart, and I'm not clear about what that is. Can you talk to me a little bit about that?
Yeah, MyChart is part of our medical group offices, and it's a patient portal. Basically, it's an online way that you can communicate with the physician and also as office. And I use MyChart as a patient myself.
Really?
So it was easy recently for me to go on and request an appointment for my annual well visit. They automatically sent me back some options of dates, and I just replied back in the email of which date and time worked for me, and it was actually in that same week. And then when I went to the physician, had lab work and stuff drawn, all of that was available to me online to look at, and he was letting me know about my results and what he wanted me to do about certain blood tests right there online. And we were able to chat back and forth, and I was also able to get prescription refills just by sending an email back to the provider.
You can email your provider?
You sure can. So
And they respond?
they do.
Wow.
They do.
That's
It's
great.
it's really, really great. I love it. Do it from convenience of home anytime.
Wow, I like that. So you, in order to have MyChart, you would have to have a Novant Medical Group physician?
Right now in this market, it's mostly the medical group physicians, but other physicians could also have access eventually to MyChart.
Wow, I think that's a great resource too. I
It's an excellent resource.
forward to seeing that grow throughout the marketplace. Well, before I let you go today, Shelburne, is there anything else that you would like to share with our viewers?
Sure, June. We're just really excited about everyone using the new facility. We'd really like to hear from the patients and their families about their experience. If they have any ideas for opportunities for us to improve services, we'd really love to hear from them about that. And I'm really excited about the growth we've seen in the last year. You can drive by there every day and the parking lot is full. We've seen a lot of growth in different service areas, and it's just a really exciting time.
I have noticed that the parking lot, I pass by there several times a day, and I have noticed that the parking lot is extremely full. And I'm curious, what do you attribute the growth to?
Well, a lot of folks are using our emergency department now versus driving elsewhere. We've seen a lot of growth around surgical services with the addition of orthopedic surgeons, the addition of the spine program with Dr. Foster. I think he's been on your show before
has
as
been,
well.
you're right.
And then the Da Vinci program that we've started, and I think they're going to be on your show as well.
They're our next guest, as a matter of fact. Dr. Wu and Kenya will be here talking about the Da Vinci system. So all of that, I guess. But you know what? I thought of one. How about the MRI? I saw this picture of it, and it's this huge thing with this big opening.
It is. It's a large bore MRI, which means the opening is much larger. A lot of people used to tell us they felt like they were in a coffin in an MRI. They used to be very small and tight. Now this one is much larger, similar to a CT scanner. And so people are more comfortable. They don't need sedation to have their MRI done. So you're exactly right. A lot of folks are coming to us for that MRI and our other imaging. We have all new technology in the imaging department. So the physicians are really referring their patients up to the hospital.
Getting back to the MRI, so people, if they tend to be claustrophobic, it's probably a lot easier for them. Is that right?
It is. We can scan the lower part of your body, and so your head is sticking out, and you can see the ceiling. And we also have a window in that room as well, so there's some natural sunlight coming in there. And patients often come out and comment how this was much more relaxing this time. They weren't nervous at all. So it's really a great experience for them.
Well, good. Yes, there are many reasons why then the growth is there.
Yeah, it's very exciting times.
Yeah, that's wonderful. It's wonderful for the folks of Brunswick County. They no longer have to go outside Brunswick County to get great, excellent care.
Absolutely.
Well, thanks again for being here. It's been a pleasure to have you back, and I look forward to the next time you're here, and we'll
Thank
talk
you.
about something else that's exciting.
It's great to be here.
Thank you. Well, welcome to the show today, Dr. Wu. It's a pleasure to have you back again.
Thank you very much, June, for inviting me.
You're welcome. And Kenya Hooper from Brunswick Novant Medical Center. It's a pleasure to meet you.
It's a pleasure to be here.
Thank you. Well, let's start by learning a little bit about both of you, your educational background and your experience. We'll start with you, Dr. Wu.
Again, my name is Edward Wu. I'm an obstetrician gynecologist with Brunswick Women's Center. I just recently relocated to Brunswick County a little over a year ago. I am a Canadian. I was born and raised in Canada and attended University of Alberta, where I did my undergraduate and my medical school training. Then I came down to the United States and did my residency training in Akron, Ohio. And I have been a practicing obstetrician gynecologist for approximately 16 years. And I am board certified.
And what is your role with Novant?
Well, again, I am a member of Brunswick Women's Center, which is a practice within Novant Medical Group. So, and in that group, we have a total of 4 physicians and 1 nurse practitioner. My partners are Dr. Tracy McCarthy, Dr. Lee Toller, and Dr. Lee Hsu, and our nurse practitioner is Sarah Brown.
Wow, great. And you practice at Brunswick Novant Medical Center, is that correct?
Yes, we do. And in fact, that is the only facility that we are presently practicing at.
So you deliver all those little babies and
Yes, we
do
do.
all that cute stuff.
Yeah, we deliver the babies and do our surgery at the hospital.
Great, great. Now, Kenya, tell me about your education and your training. Where did you go to school?
I went to surgical technology school at Millamont College in Wilmington. I have an Associates of Applied Science degree in surgical technology. Also have a Bachelor's of Science degree. I've been in the field for 9 years as a surgical technologist, but prior to that, I worked as a patient care technician in the surgical ICU. So I've been in the medical field for quite some time.
For quite some time. You have
Yeah.
a lot of great experience. Well, good. Well, it's a pleasure to have both of you here today. And I know today's topic is about the Da Vinci robotic surgical system that we've recently acquired at Brunswick Novant Medical Center. So, Dr. Wu, can you tell our viewers exactly what the Da Vinci surgical system is?
The Da Vinci system is a system that extends our capability of doing minimally invasive surgery. It allows us to mimic the movements of our hands, whereas with regular laparoscopy, the instruments are not jointed. So there's less trauma to the patient. The visualization is also better because it's a 3D camera. And the way it occurs is that the machine is what we refer to as being docked onto the patient after we put in the laparoscopic ports. And then we scrub out and we go to a console. And that console allows us to manipulate the instruments and see what we're doing where we're at the patient's bedside. So we're not actually at the patient doing the surgery, but we're at a console doing it with the robot.
You mentioned the term minimally invasive surgery. What
Yes.
does that really mean?
Well, minimally invasive just means that the incisions we use are very small. So the whole goal of the surgery is to accelerate the recovery for the patient and to minimize pain postoperatively.
And those are good things to do because I
Yes.
guess you get your patients out much quicker. And
Well, the
they
goal,
just recover much quicker.
yeah, and the goal not only is to get the patients out of the hospital and recuperating faster, but also get them back to their normal lives faster and not be laid off from work from 4 to 6 weeks or longer.
Right, yeah. Well, what types of procedures does Brunswick Novant Medical Center offer on the Da Vinci?
Well, at this point in time, myself, I am doing total laparoscopic hysterectomies with or without removal of the tubes and ovaries. And Dr. Rock McCarthy, who is a urologist with privileges at the hospital, is performing radical prostatectomies
Okay. So those are the two
at this point in time.
procedures.
Yes.
Well, you talked a little bit about a more rapid recovery, but what are some of the other benefits to using Da Vinci as opposed to traditional methods of surgery?
Well, traditional methods being open, total abdominal, again, is with a larger incision. So not only is there a faster recovery, but with the Da Vinci over regular laparoscopic surgery, there's less pain for the patient because the ports that are inserted into the patient, where they're inserted into the patient's body, it acts as a fulcrum. So it rotates around that point and it isn't moved around. Whereas with regular laparoscopy, we often have to move the ports back and forth, side to side. And that does traumatize the tissue and cause more pain after surgery.
Now, you talked a little bit about the way the Da Vinci system works. I wonder if you could elaborate a little bit more because you said that it's docked on the patient. Let's talk a little bit about what that means
Okay.
and then where you are during that procedure. And then we'll talk to Kenya and about where she fits into this.
Well, the machine has one arm specifically for manipulation of the camera. So we can manipulate the camera back and forth and also adjust the focusing. And then it has 3 robotic arms, and each of those arms is attached to a surgical instrument. And at this time, I'm only using 2. I have no use for the third, but the third is available, and I believe Dr. Rock McCarthy uses all 3 robotic arms. So once we place the robotic ports into the patient, we bring the machine, the robot, up to the operating table. And then we attach the arms to these ports. And then we put the instruments through the port, and they're controlled by the robot. And when I'm at the console, I look into a field of vision that is 3D, and the console also senses when I'm actually looking in. So as soon as I take my head away, the control of the robot is frozen, so nothing can be done.
Nothing.
And then I use 2 fingers. I use my thumb and my index finger, and they insert into 2 controls, hand controls. And the hand controls mimic the movements of my wrist exactly. So if I go forward, the robot arm goes forward. If I go back, it comes back. And if I pinch or open my fingers, the robot does the same thing. And then I also have pedals that control any use of electrical energy for cautery, whether it be what we call bipolar cautery or also monopolar cautery.
Wow, that's really cool.
It is. And this was originally technology that was developed for use in the armed forces.
Oh.
I believe it was used in a way to try and save soldiers' lives that were injured. And I don't know if they do it remotely or have ever done it remotely, but the cables that connect the robot to the console are there. So again, I'm at the patient's bedside. I'm still in the same operating room, but I'm not actually at the patient's bedside doing the surgery.
Wow, that is the coolest thing, but
It
it
is.
reminds me of a video game.
It is,
Yeah.
and in fact, using video games and the hand-eye coordination often comes into play when we do regular laparoscopic surgery, as well as using the Da Vinci robotic system.
Well, that's really interesting. Well, I'm going to shift the focus a little bit to Kenya, and I want to talk to her about your role with the Da Vinci and how do you work along with the surgeons? What would your role be?
I'm like an extension of the surgeon. When he is at his console, I'm at the patient's bedside, and I'm switching out the instruments on the robot for him, and I'm making sure that the patient is safe at all times. So, and I'm troubleshooting, making sure that everything is running smoothly.
Now, I assume in addition to the training that you had at Miller Mott in your surgical technology program, you've also had education and training with the robotic services. Is that correct?
Yes.
And was that training performed here or at another facility, or did you have to go away for that?
I've gone away to several different places for training. I've gone down to Celebrations, Florida, and worked with one of the robotic surgeons down there who does like 5 or 6 robotic cases a day.
Wow.
And so I got to spend 2 or 3 days down in Celebrations, Florida, working with him.
That's great. So not every technologist, not every surgical technologist has the skill to perform the robotic tasks. That's usually an additional training. Is
Yes.
that correct?
Yes,
Well, that's wonderful. You seem like you enjoy it.
I love it.
Well, good. Now, how long have you been a surgical tech working with Da Vinci?
5 years.
5 years. That's quite a long time.
Yes.
If the patient is preparing for surgery on the Da Vinci, what would you tell them to expect? And either one of you can answer that, or both.
Ladies first. I'll let you go
Go
first,
ahead,
Kenya.
Kenya. Tell us how might you prepare the patient? What might you say to the patient? Do you tell them what it looks like, and do you tell them what they might experience or feel, or?
Would probably explain to them what it's going to look like, because there's 3 different parts to this machine. And
Right.
so when you come into it, it's like, wow. And so I
bet.
would probably explain to them what it's going to look like
Mm-hmm.
and positioning, what type of
Right.
position they'll be in, because they are in a very steep Trendelenburg position. And so I would probably explain that to them. And
It's likely they may be already asleep by the time they
yeah,
get in there
yeah,
and won't
yeah.
remember it.
Right,
just
but
in
they'll
case
feel the effects from that, you know, post-surgical,
Right.
from being in that position.
Uh-huh.
So,
And I'm sure they appreciate that because surgery is always traumatic, whether it's Da Vinci or if it's the normal route.
Right.
It's always a traumatic experience. So, do you have anything to add to that, Dr. Wu?
I think the confusion with when patients hear robotic surgery, they think a robot is doing the surgery, that the surgeon has no actual
Right.
interplay with the robot.
Right.
But the robot is only an extension of our movements and our thinking and our skills. The robot does nothing on its own. It's all controlled by us at the console. So when patients hear that and when they first come to us or hear the term robotic, they think that they just are hooked up to this machine and the machine does the surgery and we're just there to troubleshoot or if something untoward
wow.
happens. But the correct thinking is that it's actually extending our capabilities and allowing us to do more through those small incisions than may be done with regular laparoscopy.
You said small incisions. Typically, what would be the size of an incision?
Well, the incisions for the camera and for what we call the assistance port are usually 10 to 11 millimeters. So that's less than half an inch.
Oh,
And
okay,
for
that's
the instrument,
small.
it is. And for the robotic ports, it's 8 millimeters. So that's a third of an inch. So the incisions
Wow.
are very small compared to a standard laparotomy, which you know is from the belly button down,
Right.
or what we call fan and steel or bikini line incision. Those incisions can be 6 to 8 inches in size.
Well, that's very, very small. I really didn't realize it was that small.
They are. Yeah.
Wow. Now, you talked a little bit about recovery time, and so I just wanted to clarify, you would expect the recovery time to be somewhat shorter?
Yes. Compared to an open procedure, the hospitalization is typically anywhere from 2 to 4 days.
I see.
And a recovery period is typically 4 to 6 weeks before a patient can return to work.
Wow.
With a laparoscopic procedure, usually a hospitalization is 1 or 2 days, and patients can be back within 4 weeks. But with the Da Vinci, those times are even shorter. So most patients can go home the next day within 24 hours or shortly after 24 hours. And I've had patients go back to work as quickly as 2 weeks after surgery.
Wow. Wow. Well, that is great information. I can't thank you both enough for being here. Before we close, is there anything else that you would like to add today?
Well, I think this is quite a credit to the hospital to be able to bring this technology to Brunswick County. This is a very expensive piece of technology. It's over $1 million. So it is a significant investment, and I was impressed that the Novant was investing in this technology to bring to the people and patients of Brunswick County.
Yeah, that's wonderful. Well, again, thank you so much for being here today, and I look forward to seeing you both real soon.
Thank you
Thank
very
you.
much.
You're welcome. Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. For more information on the hospital and local physicians, please visit brunswicknovant.org. Thank you again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.
Is 6:30 too early for a Get Fit workout? Are your weeknights too hectic to catch the West Brunswick football? Do you find yourself missing all your favorite ATMC TV shows? Well, now you don't have to. ATMC TV is airing all their latest shows on demand. Stop, pause, fast forward, or rewind. Watch your shows on your time. Tune to Channel 1 to see shows like Brunswick Biz, Get Fit, The Coastal Kitchen, and more. Stay connected to beautiful Brunswick County with ATMC TV on demand.